Welcome back to Hometown. More than a third of Americans are not getting enough sleep on a regular basis. That's according to the CDC. Joining me today to discuss sleep disorders is Dr. Adrienne Salerno. She's a board-certified physician specializing in family medicine and women's health. Dr. Salerno, thank you so much for joining us.
Thanks for having me.
Sleep deprivation is a national crisis. What is that magic number, and how many hours of sleep do we really need every night?
The amount of sleep that we need is actually based on our age. From newborns needing somewhere from 14 to 20 hours of sleep, to toddlers maybe needing along the lines of 12 to 14 hours of sleep. School-age kids probably need about 8 to 12 hours of sleep, and adults, we probably need still 8 hours of sleep per night.
So it's not a fixed number. Every age group needs a different amount of sleep.
Right. These numbers are relative, so every individual is going to need a different amount of sleep. The amount of sleep that we know is good, if we know we're getting enough sleep, then we should feel rested in the morning and be able to make it through our day without needing naps, without feeling tired. Those are the things that really let us know that we're getting the adequate amount of sleep.
And sleep is not something that, it's not an on-off switch. It's more complicated than that. What are some effects that it has on our health?
So as it turns out, there's a lot of effects that it has both on our brain and our health and even our long-term health. So some of the effects that we see short-term, so sleep deprivation in the short term, can help us not make good decisions. It can decrease our concentration and our focus. It can help us to feel hungrier. Our hormones that control our satiety and our hunger are regulated when we sleep. So these things can be out of whack, and we can definitely feel hungry when we're not getting the proper amount of sleep.
And obesity is such a public health crisis in America. What effect does sleep deprivation have on fat metabolism?
As it turns out, we are hungrier when we don't get the proper amount of sleep. So we tend to make poor food choices. We tend to choose foods that are higher in calories and make usually less healthy choices when we haven't had enough sleep. We can sometimes eat too much because, as I mentioned before, our hormones that suppress hunger and our hormones that help us to feel full are regulated in our normal circadian rhythm. So those hormones are not regulated well when we're not getting adequate amounts of sleep.
How do you define good quality sleep?
So good quality sleep means that when we wake up in the morning, we feel well rested. It doesn't necessarily have anything to do with dreams. Some people think that there's some correlation between dreams and if our sleep is a good quality or not. But as it turns out, there's no correlation there. So feeling rested when we wake up, being able to make it through our day without feeling tired. If we're falling asleep in our meetings or at work in the afternoons, then we're probably not getting either the adequate amount of sleep or the right amount, either the right amount of sleep or a good quality of sleep.
And, quality versus quantity of sleep, what's more important?
So quality is probably most important, but our quality probably won't be as good if our amount is not what our body needs on a regular basis. So in the short term, yes, we want to make sure our quality is good, but over a chronic basis, we want to make sure that the quantity is still there.
Does napping help?
So as it turns out, napping actually can decrease our quality of sleep. So there's certain groups of people, for example, shift workers, that oftentimes have very difficult times regulating their circadian rhythm, and they will need naps in the afternoon probably on a regular basis, and it's difficult for them to make it through their days without those. But naps longer than 30 minutes actually can impair our quality of sleep at night, make it difficult for us to fall asleep at night, and can make us a little less functional during the day. When we first wake up from those naps, a lot of times we feel more tired than we went to sleep in the first place.
And let's get to the root cause of sleep deprivation. In your practice, what are some of the common things that you see and the causes of sleep deprivation?
Poor sleep and having a hard time falling asleep are probably some of the most common complaints that I actually get. It's a big problem, and there are a lot of underlying causes that cause our sleep to be poor. There can be quality of sleep overnight that can be related to sleep apnea. So if we're snoring loudly or we're feeling very tired in the afternoons, falling asleep, oftentimes in the afternoons, or not feeling rested in the morning, those could be symptoms that we could have sleep apnea. And that would be important to bring up with your provider and get that checked out.
And anxiety is a big part of the cause, correct?
So yes, the other one that probably impairs our sleep the most is anxiety. So having a hard time falling asleep can often be signs of something else going on, most often management of stress or anxiety. So anxiety probably is the number one cause that keeps us from falling asleep at night. And oftentimes treating the underlying cause is most important rather than taking medications just to help us fall asleep.
How do you treat the underlying cause? What are some of the best practices?
So anxiety can be treated in a lot of different ways. There are medications that we use to treat anxiety. The better medications are actually medications that control the anxiety long term rather than things like benzodiazepines that just help us fall asleep in an instant and put that anxiety to bed just for the night. The other medications that really help our anxiety stay controlled on a long-term basis oftentimes are better, and then we're able to fall asleep naturally instead of taking sleeping pills that make us fall asleep instantly.
What are some best practices when it comes to sleep hygiene?
So sleep hygiene is actually the most important thing that can help us fall asleep. Good sleep hygiene actually encompasses a lot of different things. So the most important thing really is preparing our body for sleep. So preparing our body means things like regular routines. We want to go to bed at the same time every night and wake up at the same time every morning, even on the weekends. That helps to keep our circadian rhythm intact. So we want to make sure that our body is ready for sleep by the environment. So we don't want to have bright lights or loud noises in the hour before going to sleep. We want to make sure that our environment is free of screens and TVs. The blue light that are emitted from these actually suppress the melatonin that's naturally made in our bodies and helps keep our circadian rhythm intact. The other things that are important is trying to calm our body, get us into the feeling of going to sleep. I don't know if that's the right word, but we want to prepare our bodies and sort of wind everything down for the day. So you can allow yourself time to think about the activities of the day, but reading quietly is often a good thing to help prepare us for going to sleep. We want to do that under low light, not bright lights. And we also want to avoid some things later in the day to help prepare our bodies as well. So we want to avoid heavy meals, avoid excess alcohol use. More than 2 drinks a day is considered something that will help impair the sleep. We don't want to have caffeine later in the day, and maybe drink a little less liquids at night so our sleep is not interrupted with having to go to the bathroom.
What effect does the circadian rhythm have on the sleep cycle?
So that's probably the most important part of the sleep cycle. That's the reason that shift workers have such a difficult time regulating their sleep, because their rhythm is always a little bit messed up compared to those of us that work during the day and sleep at night. There's some helpful hints that they can try. We always want to try to sleep in a dark area, so having blackout shades or something to make the area where you're sleeping in dark. Avoiding, excess noise when we are trying to sleep. Those are some things to try to help regulate those rhythms for shift workers or other people that are trying to sleep during the day or times that our bodies are not really prepared to sleep.
When should someone see a sleep specialist?
So it's important to have a discussion with your provider. If you're feeling tired during the day, if you don't feel rested when you wake up in the morning, if your partner mentions that you seem to be snoring very loudly, or if you seem to be gasping for air during sleep, then those are things that are definitely important to bring up with your provider.
And let's talk about sleep aids, OTC, over-the-counter prescription versus the prescription medications. When should one turn to one?
So typically sleep aids we recommend to avoid. So most of the time, trouble falling asleep is not primary insomnia. Usually this disorder is something else. So treating the underlying disorder, whether it's stress management or treating anxiety or sleep apnea, it's important to get those things recognized and treat those things first. If we've tried everything, we've changed our sleep hygiene, we've added regular exercise, and we still seem to have a hard time falling asleep, then yes, sometimes turning to a sleep aid can be helpful. Typically, the over-the-counter sleep aids are things like melatonin and diphenhydramine. Diphenhydramine is actually an antihistamine, maybe better known as Benadryl. That's in the majority of the sleep medicines that are sold over the counter. That's probably not the best option because it can cause other side effects and sometimes interact with other medications. So it's important to talk to your provider before taking even over-the-counter sleep aids. But melatonin is probably a better one because it helps to regulate our circadian rhythm. And that can help us try to fall asleep naturally without just totally knocking us out.
And when the over-the-counter medications are not working, prescription medications, let's talk about the short-term versus the long-term medications.
Trying to find out the reason for not falling asleep instead of just, covering up with a sleep med is the most important thing. But when we do take sleep medications, there are times that we do use short-term prescription aids. So those medications, we often call them Z-meds for the prescription medications that help us go to sleep. Were meant to be used short-term or once in a while when we just have a difficult time falling asleep. Oftentimes, the problem with these sorts of medications is that patients oftentimes take them every day and our body gets addicted to them. And then we are unable to fall asleep without them. And the problem with that long-term is that we see a lot of bad effects from taking these medications every single day. So our bodies get addicted to them and they become dependent, and we can't go to sleep without them after taking them sometimes for a period of a few weeks. Long-term, we see bad effects such as increased rates of dementia. We see increased rates of cognitive decline and memory loss after taking these medications for a long period of time. Studies have shown even 180 doses of these medications in a lifetime can actually impact our memory loss and our cognitive function as we get older.
Now, patients that are experiencing anxiety and sleep deprivation are also on other anxiety medications that they can combine with the sleeping aids, and that could be dangerous.
In general, yes, anxiety is something that's very prevalent in our community today. It's something that we take medication for at times. We can sometimes take medications that help to manage that anxiety, on a daily basis. Sometimes those medications are things that are okay to combine with other medications, and sometimes they're not. So at times, combining sleep aids with anti-anxiety medications can be detrimental. There's times that certain medications interact in a way that actually cause us to stop breathing, or can definitely have bad effects when combining them together.
Thank you, Dr. Salerno, for being here.
Thanks so much for having me.
Hometown will be right back.